For the next baby issue which we'll be discussing here, this is reduced fetal movement. So this is also known as what? Fetal akinesia. Now you might be surprised that we are talking about baby stops in orthopedics. Of course, if your baby is not moving very well as they usually dictated on ultrasound, it can cause a whole lot of what? Joint issues when you give birth to this baby. Club foot, the hands are bent, a lot of issues. Do you understand? Of course, if you want to solve these issues, is what? In conjoint of what? Pediatrics and orthopedics. Do you understand? So that's why we discuss this in orthopedics too. So reduced fetal movement, also known as fetal akinesia, can be a concerning sign during pregnancy. Your baby should be happy, should be kicking, should be moving. That's why we give birth to children, to allow them to play a bit. Okay, don't allow them to stay in one place. Their bones will get too stiff. Okay, may indicate a range of possibilities. So you can be dealing with serious issues to issues that are not really that serious, right? So what it means, so fetal movement is like a key indicator that your baby is what? Functioning very well. Your baby is growing very well. So movement typically begins from week 18 to 25. Here they even talk about week 16. Okay, so a noticeable decrease or absence of movement during this time shows that your baby is distressed of something. There's neurological impairment, and of course it could be that the baby has musculoskeletal issues, or the baby will come down with musculoskeletal issues, because it's kind of like an exercise. All right, so possible causes: it could be that the baby is sleeping, so it's not something to worry. It could be anterior placenta, it could be maternal obesity. The mother is too big, so maternal factors: dehydration, the mother is taking drugs that will make her sleep. So these drugs are moving through the placenta, affecting your baby too. Could be placental issues, could be fetal conditions, could be amniotic issues. If the amniotic fluid is too small, that means it's kind of like a swimming pool of the baby. So it could be that the baby is not having a bulk of fluid to be able to swim as it wants. Okay, so evaluation and management is key count. They track the baby's movement daily. Ultrasound, where you are trying to actually pick up the real time movement. Non-stress test, then biophysical profiles.